As we read in biology as a child, arteries and veins are spread throughout the human body. Arterial oxygenated blood or pure blood spreads to different tissues of the body. And veins are deoxygenated or contaminated blood from various organs brings to the heart. By the way, there are two types of veins in the human body. There is a type of vein near the skin is called superficial vein, and the other is called deep vein. And with perforator veins outside, connects internal veins. Through this vein blood reaches to the deep veins from superficial veins. A special type of deep vein remains in the leg cuff, due to various reasons. If the blood clots, it is called deep vein thrombosis, DVT. Most of the time the DVT occurs in the leg cuff vein. Frozen clot of blood is called thrombus. And the name of the coagulation method is thrombosis. From DVT, serious illness or problem can occur in our body, one or two of which are fatal. Let's discuss some symptoms, problems, causes and healing of this disease, which has been researched with the opinions of various surgeons. Symptoms of the disease. Many people get swollen feet if they sit with their legs hanging for a long time. It is not unusual. But if little in time the leg swells, with mild pain and the skin is red there, then it will be considered as a sign of vein thrombosis. The surgeon said that one of the symptoms of DVT is swollen legs more than usual. It may be sudden or gradual. The place where blooms. If you press your finger on that place, it will go in. Apart from that, swelling part may also be slightly hot. Why does DVT happen? The main cause of DVT is decreased blood flow velocity or normal blood clotting, process problems in the vein. This disease is more common in people aged 60 or more. Although this is also the case for younger people may be a problem. People who sit or stand for long periods of time due to their work or who drive for long periods of time, they too DVT can occur. Those who are bedridden for long days due to physical illness or surgery such as paralysis. In fact, this disease can be caused due to reduced blood flow in the veins of their legs. Besides this, there are other reasons, such as increased pressure on the abdominal veins, increases the risk of DVT during pregnancy, especially in advanced stages. Many women now use contraceptive pills. In this pill, contains estrogen hormone, which is thrombogenic. Without medical advice, long-term use of the contraceptive pill can increase the chance of DVT many times over. Apart from this, smoking, even heart problems, can cause this disease. Many have frequent stomach ailments, but traditional medicines do not cure diseases. They may be diagnosed with ulcerative colitis or Crohn's disease, both belong to the bowel disease and in the group of inflammatory bowel disease, IBD. People with such IBD also have a high chance of developing DVT. Abnormal weight gain or obesity is also considered as a cause of this disease. Diseases like thrombosis and paralysis, people who have a family or genetic history of these diseases, are also at risk of DVT. Surgeons believe that DVT problems are often from the calf veins. A clot, thrombus, travels elsewhere in the bloodstream. Then this method is called embolism, and in medical language, the name of blood clot is changed from thrombus to embolus. As we know, blood from the heart goes to the lungs to be filtered through the pulmonary artery. Blood clots can sometimes pass into this artery or its branches. This is called pulmonary embolism. If small blood clots, embolus, accumulate in the pulmonary artery from a deep vein, it is called a chronic pulmonary embolism. In all these cases, shortness of breath starts gradually and increases with time. But if the blood clot suddenly dislodges and blocks the pulmonary artery completely, if so, the person may suddenly experience severe shortness of breath and chest pain and may cough up blood. It is acute pulmonary embolism, APE. APE can even kill people within minutes. That is why doctors are very concerned about pulmonary embolism. DVT should not be neglected if suspected, as per surgeon's opinion. Even if the disease is cured with appropriate treatment, there is a possibility of blood clotting again in the future. Treatment. Doctors said that it is most important to be aware of what to do and what not to do in case of DVT. For example, those who smoke have to give up this habit. For women, should not take contraceptive pills without doctor's advice, especially for long periods of time. Now many people are working from home. Take a short walk after working for a while. The same rule applies to those who drive for long periods of time. Generally, after 2 to 3 hours of driving, it is important to take some rest and walk around a bit. Those who are obese should take initiative to lose weight. Many people undergo various types of surgery as they age. Movement should be resumed as soon as possible after surgery. Those who cannot get up, at least need to move their legs and waist. Before continue the video, I want to tell one thing: some tricks help us keep our body healthy in our daily life. One such home doctor product, link is given in the description. You can see that. Let's continue. Doctors say that age-appropriate diet and exercise with the advice of a dietitian are very important in controlling DVT. If the feet are swollen, it should be used while walking. Elastic stockings, special type of socks. Besides, it is very important to take necessary medicines as advised by the doctor. This medicine can last for a long time. Monitors occasionally. Check whether the dose is correct or not. The need of surgery for DVT rarely falls, but in the case of pulmonary embolism, may be required. Sometimes a DVT patient has an umbrella-like device surgically inserted into the vein in the groin to keep the clot from moving upward. But this surgery is not done unless absolutely necessary. Diagnosis and treatment of DVT, as recommended by surgeons. It is very important to follow the precautionary measures. If not, there is a possibility of getting this disease again. Thank you.